Hello and welcome back to Curry Soup. Today we're going to be talking about asthma. It starts with something as simple as a cough, which then continues to become a wheeze, and all of a sudden they feel like their chest is all tightening up, they start breathing very heavily, become very shallow breath, and all of a sudden they become completely breathless or they have shortness of breath. Asthma is a condition which affects the small airways of our lung. We have small airways called bronchioles and bronchi, which are the tiny ones inside the lung, and this is where asthma attacks. The inside of our lung, inside the small airway, it looks something like this. There's a layer of smooth muscle which covers the airway, and inside the airway there's this layer of mucosa which actually produces mucus, this sticky substance. The purpose of this is so that when we breathe in case we inhale any dust or any particle which is not supposed to go into the lung, this mucosa traps it and throws it away, throws it out. But what happens in an asthma? When people with asthma are exposed to triggers, certain changes happen in the bronchiole and the bronchi. The first change which happens is the smooth muscles starts to constrict, so it becomes very small, and on top of that the mucosa starts becoming thicker as well. So the mucosa will thicken and start secreting so much mucus. Usually, as I said earlier, the purpose of this mucus is to trap foreign substance, foreign objects, dust particles and whatnot. But in this case, it secretes so much that it ends up blocking the airway altogether. And this is part of the reason people with asthma often have shortness of breath. I'll be explaining it in more detail in a while. When I say exposed to triggers, I mean exposed to anything which could cause this reaction, cause the airway to start tightening, cause the mucosa to become thick, start secreting more mucus. So what are these triggers? Example of these triggers are cigarette smoke, pollens, perfumes, dust, cold weather, stress, common cold, and even exercise. So once the lungs are exposed to these triggers, the smooth muscles will start to constrict. It will become tighter, it will become narrower. This is the reason why people with asthma often feel chest tightness. And as I said earlier, the mucosa starts becoming thicker and starts secreting more mucus. And this is the reason why they start coughing, and eventually they'll start wheezing. Why wheezing? Very simple. If I open my mouth and blow, there's no sound. But then if I narrow my mouth, all of a sudden there's a sound. That's exactly what happens in the lung as well. When the airway narrows, it starts producing this whistling sound, and this wheeze is often only during expiratory phase. That means when they are breathing out. So that explains all the symptoms of asthma, and all this in combination produces the effect of having shortness of breath. Ironically enough, people with asthma have a more difficult time breathing out than inhaling air. It means it's more difficult for them to push the air out of the lung. The body has to work very hard, and this situation creates a condition called hyperinflation. If we look at a chest x-ray, we can see that the lung is totally bloated up, totally expanded fully. Even the diaphragm, the bottom part of our lung, is completely flat sometimes. This is why in patients with very chronic asthma, that means they've been having asthma for a very long time, these people often have something called a barrel chest. The chest just looks very rounded. It almost looks like a barrel, like a pigeon pushing its chest out. That's how they look like. So what is hyperinflation? Basically, it means that there's too much excess air trapped in. The body can't push it out. You can breathe in, but you can't breathe out. So all the excess air is inside. So let's say you breathe in like 100 units of air. When you exhale only 50 units of air. And the next round when you inhale again, you're inhaling another 100 units of air, but you're exhaling only 50. As time goes on, you're going to have air trapped everywhere. And this will make oxygenation very difficult, because it's difficult for fresh oxygen to actually go in and permeate through the lungs to give our body enough oxygen. In very severe cases, if asthma is not controlled, the symptom is not tended to immediately or resolve immediately, could even lead to death because of lack of oxygen. How do we prevent asthma, or rather how do we prevent an asthmatic attack when someone already has asthma? In case like you already have asthma, how would you prevent the attack from happening? How would you prevent future exacerbation? Very simple. The number one thing is to avoid all these triggers. If you have asthma, you would know what are your specific triggers, but then generally the triggers I mentioned earlier, the smoking, pollen, perfume, exercise, cold weather, flu, all these can be avoided. But we can't control the world, we can only control ourselves. So even if we move away from smoke, some very smart guy might be sitting in a restaurant and smoking in front of you, might even blow the smoke on your face. So what happens then? The second method, which is using inhalers. I'm sure all of you already know what inhalers are or how they look like. It's quite popular in movies as well. It's this tiny blue pump which asthma patients use to inhale. There are two kinds of inhalers, the relievers and the preventative inhaler. The relievers are the ones we often see everywhere, the blue color pump. It has something called a beta blocker, basically a drug to start relaxing the smooth muscles. If you remember earlier, I said the smooth muscles tightens. Using beta blockers will let it relax a bit more. So this would relieve the symptom and allow air to go in and out much smoother. The second type of inhaler are the preventative inhalers. This contains something called a corticosteroid. A corticosteroid is basically a substance which reduces the sensitivity of certain part of your body, in this case the mucosa. It reduces the sensitivity of the mucosa so it doesn't swell up very fast, it doesn't inflame very fast. And this is a drug which is only given in long-term asthma patients. That means if the condition is very bad, the control is very bad, then the doctor will have to give you something so that you don't damage your lung further. So it's very, very important to always take your medication as prescribed. If you're supposed to take it twice a day, take it twice a day. The blue pump, however, the reliever, that is usually only when there's an exacerbation. That means only when you have an asthma attack, you use the blue pump. Otherwise, you don't need to. If you found this video informative and valuable, the only thing I ask you to do is share it with your friends, spread the knowledge. If you haven't subscribed to us yet, go ahead and smash the subscribe button and click the bell icon, because YouTube's algorithm is changing all the time and we want to make sure that our video actually comes and reach you. And until the next informative video, in anything you do, do your best and be the best version of yourself. Bye-bye.